Miss Lucy.
Hi.
I have you in today for your annual head-to-toe assessment.
Yeah.
And go ahead and breathe out. And one more time. And breathe out.
LTFP.
Skin is very clear, nice and even.
Soft.
Can you feel me touching you here, Lucy?
Mm-hmm. Yeah.
Along your toes, can you feel that I'm touching you?
Like slightly.
Do you feel it any less on the bottom
Mm-hmm.
than you do on the top?
Yeah, way less.
So I was looking over your chart. It looks like it's been about a year since I had you in last.
Yeah, it's been a long time.
Okay, so how are you feeling? Is there anything specific that's been going on recently? Anything I should know about?
No, I think everything's good. I just got the flu maybe a few months ago, but that's about
So
it.
pretty standard, nothing super concerning.
Mm-hmm.
So I'm just going to update your chart here while we're talking.
Mm-hmm.
All right, so you said you had the flu.
Mm-hmm.
All right. Any hospitalization with that, or just kind of dealt
No.
with it at home and
Yeah.
you were okay?
Yeah, it just lasted a few days.
Did you have your flu vaccine?
No.
Okay, all right, that's totally fine. You're fairly young and in decent health, so it's typically something I do recommend annually, but personal preference and definitely more recommended for those elderly or immunocompromised. So it's not something I really worry about as far as your health goes. And as far as everything else with your health this year, has anything changed with like your eye health? Have you gone to the optometrist recently?
I feel like my vision has gotten maybe a little worse.
Okay.
I think I've always had good vision, but as of late, like I feel like in classes, like when I'm in class, like seeing the board,
Okay.
I think that the numbers maybe are starting to feel a little blurry.
Okay, and do you sit fairly close to the board or a little bit further
No,
back?
further back.
Okay, and that's something that you've noticed more so recently.
Mm-hmm. Yeah, I think I need
Okay.
glasses or something.
So, change of visual acuity is something that I can test for in office. So I'll do it on a little bit more of a brief spectrum. I will test with a pocket chart, and then any issues with like your color vision. Are you noticing any color deficiency?
No, not to my knowledge.
Okay, so I'll check it just in case, and then obviously if either of those come out abnormal, I can refer you to an optometrist and then maybe get you fitted for glasses. Have you ever worn glasses or contacts?
No, never.
Okay, all right. Okay, and with your change of vision, have you noticed any like headaches or floaters of the vision, any kind of double vision, migraine symptoms?
Some headaches.
Some headaches,
Yeah.
okay. And is that kind of abnormal for you?
Yes, definitely.
Okay, all right. Do you spend a lot of time looking at a screen or looking at your phone?
Not really.
Not as much. Okay. All right. So as far as the headache itself, can you tell me about where on your head you feel pain? Is it more like in the temples, near the eyes, or like completely behind the head?
Mm-hmm. Yeah, it definitely feels like behind my eyes, and then sometimes like if I'm driving, like I notice like I don't know if it's like related to my vision, but like I'll have to like kind of like squint my eyes a little bit.
Okay, all right. So those two things tend to go hand in hand for you. So I do want to have a look at that as well. I'll do a bit of a lighted Penlight exam.
Perfect.
Kind of have a look at your eyes.
Okay.
Have you noticed any sensitivity to light at all?
No, not really.
Not really good. Okay, all right. So we will have a look at that for sure. I've made a note here. And then if we move on to your other senses, any changes in your sense of hearing?
No.
Nothing with your ears, no pain of the ears, abnormal earwax?
No.
Okay. And then nothing with your sense of smell? Do you have any issues with seasonal allergies or?
I used to have really bad seasonal allergies, but I feel like they've gotten a lot
little
better.
bit better?
Yeah.
Okay.
I don't know why that is.
Alright, so you have a little bit of history of seasonal allergies, but nothing recent and no changes to your sense of smell. Not smelling anything that other people aren't smelling or smelling of smoke or anything like that?
No.
And no changes to your sense of taste?
Yeah, no changes.
Alright. And then as far as your sense of touch, have you noticed any excess sensitivity recently or anything going on with like your overall sensation? Typically is pretty normal unless there's been some sort of neurological event, but I do just like to ask.
No, yeah, it's normal.
Okay, good. Alright, and then if we move down to a few questions about kind of lower body, any issues with your digestion, any changes to your diet recently, changes to your intake?
No, same diet.
Okay. Drinking plenty of water?
Yeah.
Alright. And then any pain of the joints or lower extremities, knees, ankles, feet?
No.
Good. Alright, and then lastly, anything with your back, any upper back pain, lower back pain?
I commute a lot, so I'm in my car a lot, and so I'm noticing maybe I feel like I feel stiff.
A little bit stiff. Okay.
Yeah.
Alright, so I will have a look at that. Could be either something going on with your back or maybe just a posture issue. So
Okay.
maybe we can look at your posture and see if there's anything concerning there. We do tend to kind of slump over in the car, so something to be aware of, but I'll definitely have a look. Would you say that's more so upper back or lower back or just kind of all of it?
Lower.
Lower.
Yeah,
Okay.
lower and maybe like my neck a little bit.
Okay. On one side or both sides?
On the side, on my left.
Side, okay. So a little bit of left side stiffness of the neck. All right. Just out of curiosity, because you said you've had some left side stiffness and then as well as the headaches. Any excess tension of the face, like tension of the jaws or tension above the brow bone? Do you tend to clench your teeth at all, anything like that?
No, not clenching my teeth, no.
And no loss of sleep or lack of sleep, disruption to your sleep cycle?
No.
Good. All right. Okay. So I think that's everything that I need from you today as far as your updated health information. All right. Okay. All right, Lucy. So let me just set this down and then we can go ahead and begin with our physical examination. Now, I think the first thing I want to do is get a set of your vital signs, if that's okay.
Yeah,
So
perfect.
regular temperature, blood pressure, pulse oximeter, see how your oxygen saturation is doing.
Perfect.
So let's go ahead and start by getting your blood pressure.
Perfect.
Do you have a preference which side I take it on?
Either's fine.
I'll go ahead and take it on the right since you're just a little bit closer to me here. Alright, so I'm going to go ahead and place this on your arm. Give you just a little bit tight. And then I'll have you just relax with your arm flat on your, just like that is perfect. Go ahead and touch. Alright, so I'm just going to place my stethoscope on. Lucy, so I'm going to place this at the inner elbow. Just make sure I can hear your heart rate. So I will hold here. You're going to feel it pump up. It's going to be just a little bit tight. I want you to just breathe normally.
Okay.
Very good. So your blood pressure is actually within a really good range.
That's good news.
I'm reading about 112/68, which is actually a little bit on the lower side for your diastolic, but that's totally fine.
Okay.
Good. So very good heart health. That's a good sign. I will also perform a stethoscope inspection in which I listen to your cardiac health.
Perfect.
Overall, as far as your blood pressure goes, that is very good news. Okay. following up on that, I am going to measure your oxygen saturation. So get this plugged in. I'm going to go ahead and put this on your fingers. Perfect. I'll have that sit there. And then again, just breathe normally. That will measure your heart rate for me. And while that's reading, I'm going to go ahead and measure your temperature. So just measuring for average temperature variation. So I'm going to measure a couple different spots and see if there's anything that looks concerning, any areas of increased fluctuation. I'm just move your hair a little bit here, Lucy. Okay. Just a little bit warmer here at the temple. Okay. So just gonna measure on this side. Okay, so average reading about 96.4. Now I will say that your hands are pretty cold, so definitely below normal here. At the hands. Is that normal for you? Are you typically colder at the hands and fingers?
Yeah.
Alright. It looks like your oxygen saturation is at 99%, so that's good. You are breathing very
Perfect.
well. Okay. So, lastly, since this is your annual examination, I am going to just take an oral temperature here as well. So I'm just going to place this in our protective sleeve. Has a plastic cover on it. I'm going to place it underneath your tongue. And I want you to just bite down. It's going to measure your temperature. Very good. Okay, so oral temperature is 97.4, which is
Perfect.
Completely within normal limits. All right. Why don't we go ahead and perform your stethoscope auscultation? So essentially what that means is I'm just going to be placing my stethoscope in my ears. I'm going to have a listen at your heart, and then I'll have a listen at your lungs, make sure there's nothing concerning going on there.
Perfect.
Have you ever had any history of cardiac or pulmonary health?
No.
And you've never seen a specialist for anything?
No.
Okay, good. So this should go fairly routinely.
Okay.
All right, Lucy, so I'm just going to go ahead and have a listen to your heart. I want you to just breathe normally for me. Just try to sit relaxed. I'm going to start here, just at the shoulder. Good. And I'm going to come slowly inwards towards your heart. So far, very good perfusion, not hearing any signs of occlusion. Heart rate is strong, nice and even on both sides. Just gonna move your hair, Lucy. Thank you. Very strong on the left side. All right. So now I'm going to listen to your lungs. If I could have you just turn slightly for me. Just going to move your hair here slightly, Lucy. All right, so just listening here, just behind the shoulder. Just going to have a listen to your lungs, listening to your pulmonary health. Is there anything that sounds particularly abnormal? So far that sounds okay. Just going to auscultate bilaterally, so I'm listening on both sides. I want to hear if there's any difference from one side or the other, but so far everything sounds equal. I could have you take a deep breath in for me, Lucy. And go ahead and breathe out. And one more time. And breathe out. Very good. Okay. All right, Lucy. You can go ahead and sit comfortably.
Perfect.
So I'm just going to catch up on my notes. So your heart and lung assessment all sounded very good. Your vitals in general were all well within normal limits, so that's a really good sign. For your age, we'd expect to see that your pulmonary health is intact as well as your cardiac health. You've never had any history, so there shouldn't be anything there, and I didn't find anything today.
Perfect.
And I am very happy with your blood pressure levels. That is a very good sign. Just want to make a note here that for 110, 65, 99% oxygen saturation. And then I will have just a little bit of a look at your hands because they did feel just on the colder side.
Okay.
So I'm just going to have a feel for your upper extremities in general.
Okay.
So I will do some palpation kind of everywhere, but just as far as temperature goes, I just want to feel up at the arm to start with, and then I'll move down towards your hands. So skin overall is just slightly on the cooler side. Just a little bit chilly in here, so just gonna have a look at your hands here, Lizzie. Beautiful jewelry.
Thank you so much.
Love the variety and texture. Skin tone overall is nice and even. Nails are very well groomed, nice and clean. Palms, very soft, no signs of callus. Now just overall your hands are just a little bit on the chilly side. Do you tend to find the same with your feet as well, or is it just your hands? Your feet are usually cold?
Yeah.
Okay. So have a look at this side as well. Again, your bracelets are just so cute.
Thank you so much. My mom made me this.
Did she really? Oh, that's very sweet of her. I love the color green, is my favorite.
Oh, that's so nice to know.
Your skin is very soft, nice and smooth. I do see just a little bit of freckling, which is totally normal. All right, so when you spend time out in the sun, are you making sure to wear sunscreen?
I could get better at that.
Okay, all right. So I just do try to recommend that you are wearing sunscreen anytime you're spending more than 15 or 20 minutes outside in direct sun exposure.
Yeah.
So something to keep in mind.
I've been at the beach a lot lately,
Have
and
you?
yeah,
Okay.
and I forgot my sunscreen.
Okay, so definitely if you're spending time in direct sunlight, I would recommend wearing sunscreen
Okay.
of at least SPF 50, especially on your face and kind of upper body. Any areas really that are going to be exposed, like your arms, especially if you're wearing a bathing suit, make sure you have someone assist you with your back.
Okay.
It's very important to protect ourselves from the sun.
Perfect. Thank you.
Of course.
I'll get better at that.
We all could be better at a lot of things.
Right.
So I'm going to perform what's known as a visual inspection. Now we performed something similar last year. So essentially what that means is I'm just going to use my Penlight to kind of have a look at your eyes, just externally. Have a look at your skin, any postural misalignment, that kind of thing.
Perfect.
Okay. So I want you to just kind of sit relaxed and natural, and I'm just going to have a look over you. There's nothing specific you need to do.
Okay.
So I'm just going to start here at the head. Just having a look for symmetry of the brow, which is intact. Nice and even at the arch, and as I come down, corners of the eye meet at the same point. Nose is midline to chin. Lips are nice and full, very well hydrated. As I come towards the clavicle, alright, just clavicular lines are nice and even with the shoulder, which is very good. Elbows are in line with the abdomen as well, and there's no protrusion at the chest wall as we come down towards the rib cage. Now again, skin is very smooth. I will have a look at the lower extremities when I have you laid down.
Okay.
And then I will have a look at the abdominal region as well. But as far as I can tell, your skin is nice and even, tone is even. I don't notice any obvious damage from the skin, very smooth, nice and dry to the touch, but not overly dry, no signs of flaking or anything like that.
Perfect.
Very good. And you never have any issues with any dermatological conditions such as psoriasis or eczema, any flaking of the skin, nothing like that?
No.
Okay, all right. Very good. All right, Lucy. So I think at this time we can go ahead and move to a bit of our cognitive tests.
Okay.
So I'll do a bit of your visual acuity and color deficiency, that kind of thing. And then after that, it'll be mostly physical portions of the examination. I'll check your eyes, check for nasal patency, that kind of thing. I do want to perform a bit of a scalp inspection, specifically because you said you've been feeling some of that tenderness. So I want to feel for any tenderness of the cranium. Aside from that, I'll do the lower body examination. If it's okay with you, I'll have you change into a gown. So for now, let's go ahead and test your visual acuity. Now, you said you've never worn glasses. You don't usually have trouble. This is something more recent.
Yeah. So the last maybe 6 months.
Okay. All right. So we'll test with a couple of different things. Why don't we start with just our regular Snellen chart. Now I have a chart here. Let's see. All right. So this is a pocket chart. Now I am going to hold it at about arm's length. I'm going to point at a couple different letters. I want you to just indicate which letters you see.
Okay.
So we'll start with both of your eyes open.
Okay.
And I'll hold it about here. Can you tell me what letter that is?
E.
In here?
F. P. H.
And if we jump down?
D. H. J. B. S.
And can you read that lowest line?
L. T. F. P. H.
Very good. And if I have you use this card to just cover one side, you can choose which side. I'm going to have you attempt to read the lowest line.
L. T. F. P. H.
And then if we can switch eyes.
Okay. L. T. F. P. H.
Okay. Did you feel like either of those was difficult for you, or did it feel about the same?
Yeah, I think this one felt a little difficult when I covered my right.
Okay. All right. So I would think, is it mostly at night when you're having trouble, you said, while you're driving? Okay. And then you also said while you're in class. So I do think we're seeing just a bit of nearsightedness.
Okay.
So you're having trouble seeing a little bit further away. We may be looking at a bit of an astigmatism just because you're saying one side seems to be more difficult from the other side. So I think as far as your visual acuity, I do want to refer you to an optometrist.
Okay.
I still have your vision at about 2020, 2015. An optometrist will test with different charts at different lengths.
Okay.
And then they can also have a closer look in the eye itself. Maybe give you a very mild prescription that can help with that.
Okay, perfect.
All right. Especially while you're in class and you're trying to focus on the board.
Yeah.
Okay. All right. So why don't we go ahead and have a look at your color deficiency. Now, it's not something you've experienced in the past. We likely won't see a positive indication today, but I have what's called an Ishihara test plate. So I want you to look at this plate for me. Now, you should see a number here. Can you read that number to me?
12.
Very good. So I'm going to go through a couple different color variations. So if we do here,
8.
in here,
5.
good. In here,
29.
good. In here,
74.
very good. And then I'm going to jump. It's a little bit harder here.
39.
lastly, I have a bit of a trail here. So do you see that there's a color here?
Yes.
Can I have you try to trace that from start to finish for me?
Okay.
Very good. Did you feel like any of those were particularly difficult for you?
Maybe the one that was like black and white
Okay,
a little
so
bit.
a little bit of difficulty with the red.
Yeah.
All right, so I will mark that down. I do think that may be something else that we would want to mention to optometry.
Okay.
Now, this last thing I have is just kind of a checkered board. So it has a letter on it. Can you see this letter?
Yes.
So I am going to have you focus on this letter as I move it around.
Okay.
So I want you to just try to focus your vision here at the center. Tell me if as I bring it closer to you and further away, if it starts to double at all. So if you see more than one, I want you to let me know.
Okay.
Okay? So I'm going to start by moving this around, and I'll ask you, so can you see the letter now?
Mm-hmm.
So just follow it for me. Any double vision as I bring it closer,
No.
and then move it further away.
No.
And as I bring it directly in the center, any double vision?
I think a little bit
A
there.
little bit there?
Yeah.
And as I bring it further away, any double vision?
No, not at all.
And then if I bring it in from the side, any double vision?
A little bit.
A little bit. So you are getting just a little as I bring it closer to
Yeah.
your face. All right. So that is a positive indication. I am going to mark all of that down. I do have an in-house optometrist that I recommend to our patients. Of course, you are welcome to go with whoever you're comfortable with, but I can give you a referral, and we tend to just be able to get you in a little bit faster.
I'd really like that.
Okay, of course. So I will get all of that settled for you prior to the end of your visit.
Thank
Let
you.
me just make a note here. So I have you down for a consult to optometry. Okay, all right. All right, Lucy, so let's go ahead and move on to the more physical aspect of our examination.
Okay, perfect.
So I have a couple different things that I'm going to test with you. To start, I'm going to do the scalp inspection, and then I'll test for your pupillary constriction and dilation, and then we'll move on to the physical exam of your body.
Perfect.
So why don't we finish up with the eyes first?
Okay.
I'll have a look in them. I'll test for constriction, dilation, normal reaction to light, and then I'll have you change position so that I can perform a scalp examination.
Okay, perfect.
So I'm going to shine this directly in your eyes. It is fairly bright, might be slightly uncomfortable, but shouldn't cause you any pain.
Okay.
So let me just kind of relax for me. So I'm just going to start here. So I'm going to have you just kind of look lazily. You can blink whenever you need to. Just going to shine it in your eyes in every direction. Have a look at normal reactivity to the light. So far, are you feeling any sensitivity here?
Mm-hmm. A little bit.
A little bit in both eyes?
Mm-hmm.
So as I kind of come from the side, just looking for normal response directly in this eye, and then as well as consensual response here, which is intact. Come just between the eyes and look for mutual response, which is intact as well. If I occlude one side, I can test individually here. Just look okay.
Yeah, the right feels weaker.
Does it?
Mm-hmm.
Okay. So maybe some slightly delayed response there. So do want to palpate around your eyes as well. Alright. Okay. Alright, Lucy, so I'm going to have you change positions just slightly for me. I'm going to feel around your face, feel around your scalp, see if there's anything I'm noticing there.
Okay, good. Perfect.
Alright, Lucy, starting with the head palpations. Now, you said you're feeling a lot of that tenderness kind of behind your eyes.
Mm-hmm.
So I'm going to palpate along the face, along the brow bone, along the eyes, and you can let me know if any of it feels uncomfortable or painful.
Okay, thank you.
Alright. So just relax for me. You're welcome to close your eyes or whatever is more comfortable for you. I'm just going to move your hair here slightly. Just going to start by feeling around the face. palpate around the temporal region. Just kind of gentle pressure here. Feeling for any abnormal nodules or any areas of pressure. Feeling directly along the brow. Down into the mandibular joint. Just having a look at the neck. I don't note any swelling here, but I do just want to palpate directly underneath the jaw, along the chin. And I'm going to come down the neck where we have a chain of nodes. Just going to feel here at the clavicle. Any signs of swelling? Sometimes swelling gradually leads down towards the lymph nodes, but it does feel okay. Alright. So, I'm just going to feel along this side as well. I'm just going to move your hair here. And as I palpate this side, I want you to just let me know if there's any pain or tenderness. Not feeling any areas of swelling. Again, no pockets of fluid. Maybe some slight warmth here on the right side. As I come down towards the jaw, again, I'm going to palpate just below the jaw. Down along the TMJ, and then going down again towards the clavicular chain of nodes. Feeling right at the clavicle on the right side, both above and below. And bilateral palpation, feeling for any abnormalities from one side or the other. Alright. So I'm going to feel along your scalp as well. I want to feel for any areas of tenderness here. So I'm going to palpate directly along the scalp. Don't feel any nodules on the right side. Does any of this cause you any discomfort or pain? No. And if I feel at the base of the scalp, we tend to hold a lot of tension here. I do feel some warmth, actually. Do you have any tenderness here at the base of the scalp?
Yeah.
A little bit. Is it more so like here on the sides or directly in the middle?
In the middle.
Just a bit of a closer look at that as well. Let me see, so just performing a brief inspection here of the back of the neck, because you said you were feeling a little bit of tenderness here, so I do find that the nape of the neck is a rather sensitive area. Having a look with my Penlight, I don't see anything of particular concern. Skin is very clear, nice and even. So I'm just going to palpate around for any areas of swelling. Parting your hair very slightly, feeling directly at the base of the scalp. Don't feel any swelling there. And as I come down directly on the base of the neck, I'm just going to palpate here, coming down along the spine. allows me to feel for any swelling in between the vertebrae. And if I feel along the shoulder as well, I do feel just a little bit of tension there. Just some tension of the scapular indentation. Maybe some mild edema as well. So overall, this feels like a bit of tension built up at the neck. It could be from the straining you said you were experiencing while looking at the board. It could also be from posture while sitting in the car. Okay. All right. All right, Lucy, so I do think that most of that is just related to your kind of headache and behind the eye tension. Now I would like to go ahead and have a look at the lower body, just a brief palpation of the abdomen, and then of course a look at your lower extremities. So I'm going to have you change into a hospital gown for me just to allow for better access. Perfect. I'll have you lay down and then we'll continue with your examination.
Thank you so much.
Okay. All right, thank you. All right, Lucy. We're going to start with the examination of the lower part of your body. You said there wasn't anything that you're experiencing today that I should be concerned about. No. Okay, all right. So to start with, I'm going to do some very brief palpating of the abdomen. Nothing extensive. I'm just going to be feeling around like this, mostly feeling for the organs, feeling for abnormal distension of your stomach. Okay. Okay. So I'll have you just relax for me. Just take normal breaths. Okay. I'm just going to feel here, just palpating at top of the abdomen. I'm going to start here in the upper left quadrant. Then as I come down, I'll do a bit of a deeper palpation. So far, no signs of distension. None of that feels abnormal. So I'm going to percuss slightly here. Allows me to hear for any abnormalities, but all of that sounds okay. And no pain or pressure with any of them? No. Okay. All right. Good. So we can move down to an exam of your lower extremity. So I'm just going to have a brief look at your legs. Okay. Look at the overall skin health, texture, that kind of thing. Okay. Okay. So I'm going to start by just feeling around. Now, you did say that your feet tend to be cold, so your toes are fairly cold. Yeah. Okay. And is that something that you've always had? Yeah, I think so. Okay, all right. So some people just have, poor circulation in their hands and feet, and that can be totally normal. Okay. Overall skin texture, I would say, is very smooth, nice and even. Nothing that feels abnormal there. And you are nice and warm up at the upper leg. It does just start to get cold, kind of right about here. 1.5 to 2 inches for the dorsal part of your foot before it starts to get cold. So I'm just going to feel at the ankle. Swelling or inflammation there. Is there any tenderness at the ankle? Does that feel okay? It feels okay, yeah. The other side as well. Just a little bit cold at the feet. It's mainly the toes that are chilly. Actually, I would say that your left side is just a little bit colder. So I'm going to test with my thermometer gun. This will give me a bit more of an accurate reading. Okay. So similarly to what we did around your face, I'm just going to test at the legs. So I will do one side at a time. So we've got a base temperature of about 96.9. So definitely colder as we come down towards the toes. I'm actually getting a low reading on my thermometer, so it's not able to register the temperature, which tells me that it is far below average. So when we come down here, you can see I do get a reading here about 96.6. and then we jump to 92, and then right across the toes, we're not getting a reading.
Oh, wow.
So it is very cold, and then if we do the same thing on this side, so we'll get a base temperature. Then we go down there, again 92.3, and then a low on the toes.
Oh, gosh.
So it is fairly cold, and then if I come plantar, again, too low of a reading. Okay, all right. Just palpating here directly along the toes. Is there any pain or discomfort here?
No.
No sensitivity or anything?
No.
Any loss of sensation? So because they are quite a bit colder, I'm slightly worried about a lack of sensation. So just as you can feel me touching you here at the upper leg, as I come down, does that feel any different?
It feels more sensitive
More
on my
sensitive.
toes.
Okay. Maybe some slight neuropathy there. So just going to test for capillary refill. Now because your toes are groomed, I'm just going to squeeze down at the very tip here and have a look at color return. Now I will say that I am seeing slightly delayed response here in capillary refill.
Okay.
And that is just because your toes are so cold that there's definitely a lack of blood flow there. So test on this side as well. Okay. Alright. Okay. So I'm going to do just a brief test for sensitivity here, Lucy. So
Okay.
why don't I go ahead and use this tool here. So I have just a regular kind of elongated Q-tip essentially.
Okay.
So just to give you an example, if I touch you here at the face, can you feel that that's pretty soft?
Yeah.
And then if I use the other end, can you feel that that's kind of slightly blunted, not pointy, but just a little bit sharper? So what I'm going to do is start here at the upper leg, and as I come down towards your feet, I want you to just continue to indicate when you feel something.
Okay.
So you can either just nod your head or say yes, you feel it.
Okay.
Feels out there? You feel out there?
Yes. Yes.
And as I come down towards your
Yes.
feet, can you feel all of that? Feel that along your toes?
A little bit on my toes.
Feel a little bit less?
Yeah.
So you say this definitely feels slightly different than that?
Mm-hmm.
Okay. So now I'm going to have you close your eyes. I'm going to alternate the sensation just like this.
Okay.
I want you to try to indicate which you feel.
Okay.
Okay?
Perfect. Soft. Soft. Sharp. 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 Soft. 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 Sharp. Sharp. Soft. 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 Sharp. Sharp. Soft.
Okay. All right. You know, your eyes, Lucy. So there were a few that you got incorrect.
Oh.
There were a couple sharp that felt more soft, and then there were a couple that you alternated specifically near the feet. So I do think that there might be some mild signs of neuropathy happening, some peripheral neuropathy, excuse me. So I have a bit more of a distinct tool now. I mostly want to use this to test for cold response. So I'm just going to show you in your hand here. Can you feel that that's pretty sharp?
Mm-hmm.
Okay. And then can you feel that that's fairly cold?
Yeah.
Okay. So I'm going to have you close your eyes. To start with, I want you to tell me if this feels any less sharp as I come down your leg. So for example, just very lightly touching you here, you should feel that that's fairly sharp.
Mm-hmm.
And then if I come closer to the toes, does that still feel the same sharpness?
Not as much.
Not as much. So I'm going to come down your leg. We'll start here. coming down towards the ankle. Does that feel different sharpness here?
Mm-hmm.
Yeah. And then same thing on this side. Does that feel different sharpness?
Right there.
Right there.
Yeah.
Okay. Does it feel the same this side and this side?
Yeah.
Yeah. And then, can you feel that this is fairly cold? Maybe slightly?
Yeah, slightly.
Okay, let me try a different tool. Does this one here feel cold?
Mm-hmm.
Okay. So as I touch your leg and then come down, does that feel any less cold as I come towards the foot?
Right there.
Right there. And on the plantar side, does that feel
I can't even really feel.
You can feel that, okay. And on this side, does that feel cold?
Mm-hmm.
Cold here. Still cold.
Mm-hmm.
And then down towards your toes.
No.
No. And then if I touch you here, does that feel cold?
Mm-mm.
No. Okay. All right. Okay. So the last thing I'm going to do as far as your feet is check for your Babinski reflex. So what I'm going to do is I'm going to test by just dragging something up the base of your foot.
Okay.
And I should see just kind of a neurological response. So I'm going to take the weight of your foot in my hand.
Okay.
I want you to close your eyes just to allow your muscles to react. So we're just going to relax the foot. And then this might tickle just a little bit, but it shouldn't cause you any pain. See, I'm getting normal response to Babinski, maybe slightly diminished. Can you feel me touching you here, Lucy?
Mm-hmm. Yeah.
Along your toes, can you feel that I'm touching you?
Like slightly.
Do you feel it any less on the bottom
Mm-hmm.
than you do on the top?
Yeah, way less.
Alright. So I'm going to do the same thing on the other side. So I'll just take the weight of your foot here, and I want you to just relax the muscles for me. That's very good. Good response to Babinski. Again, slightly diminished here at the pad of the foot. Can you feel that I'm touching you here, Lucy?
A little bit.
Definitely less than the top.
Mm-hmm.
Does it feel any less on this side than it does on this side?
Yeah, less on this side.
Less on this side. Okay, alright. Okay, you can go ahead and relax. I'm going to have you sit up for me and we can discuss what I think is going on.
Okay, perfect.
Okay, so completed the lower extremity examination. I did find just a couple things on your feet, so I'm going to make a note here, and so I am going to refer you to a second specialty. So aside from just your general optometrist that can have a look at your visual acuity, I'm going to refer you to a specialist that can have a look at your hands as well as your feet. I do think we need to just have a little bit more of a look at your circulation. They might end up putting a secondary consult into neurology. There were just a few things that were indicated as abnormal as far as your foot exam and sensory components go. So your Babinski reflex was intact. I want to make sure to note that because that one is very important.
Okay.
But you did have some issues with your soft versus sharp sensation. So the specialist can kind of go over that, see if there's anything neurological happening or if it is more of a kind of neuropathy that's on the surface of the skin. Either way, they'll be able to test that further for you.
Perfect. Thank you so much.
Of course. So I will go ahead and put both of those consults in for you. And otherwise, did you have any questions for me pertaining to today's examination?
No, I think that's it.
Okay. All right, Lucy. Well, I will give you a few minutes to change.
Perfect.
Those referrals will be ready in your portal. If you'd prefer a physical prescription, I can give that to you, and then you can reach out directly.
Oh, yeah. That'd be great.
Okay. All right. So why don't I go ahead and do that for you then, and we will have you on your way. So I will just write that out for you.
Perfect.
I do believe I have my. There we go. So you can take this up to Rachel at the front desk. I'll just make a note here. We have Lucy, Ricardo, room 1. You're going to go to optometry and secondary specialist. All right. Okay, there you go.
Thank you
Give
so
you a couple
much.
minutes to get dressed. I'll let Rachel know to expect you.
Perfect. Thank you.
Of course. Have a good day.
You too. Take care.